Hello, everyone. My name is Madilynn Hintz, and I'm a fourth-year Creighton medical student from Phoenix, Arizona. And I will be presenting on a review of the benefits and drawbacks of teledermatology. If you have any additional questions or comments, I've left my email at the end of this presentation, so please feel free to reach out. I have no disclosures. Here's a quick outline for the presentation. So really quickly, I'd like to define teledermatology, which is the use of digital communication to provide dermatologic care. And there really are two approaches or methods to telederm. The first being store and forward, where pictures are taken of the patient's skin and sent to a provider to be reviewed at a later time. This is in comparison to real-time methods where a patient and provider will set up a time to do live video conferencing, which is the more traditional understanding of how we understand telemedicine visits. And so telederm, although it's been around since the 90s, its use has steadily increased, and more it's being adopted into dermatology practices. And with that, it's become a really important part of patient care. And so what we wanted to do is look a little bit deeper into this topic and sort out what the benefits and drawbacks of using telemedicine are within the field of dermatology. And with that, also identify any gaps in the literature and areas that are needed for ongoing investigation. So the way that we approached this is we did a scoping review of articles published from 2019 to 2025. We looked at 3 different databases, being PubMed, Web of Science, and Google Scholar. Any article that was published in English was eligible for inclusion, and articles that were excluded were editorials, book chapters, or letters. And the areas that we were most interested in investigating were centered around telederm's impact on accessibility, patient care quality, as well as diagnostic reliability, security risks, as well as insurance and policy. So of the 115 articles that we surveyed, 62 of those met our criteria and are represented here in our pie chart. Approximately 29 of those were systematic reviews that looked at the pros and cons of each subject interest as well. And so I'd like to start out with accessibility. So telederm has really shown to be useful for expanding care in underserved populations. And one of the ways that it's done this is through decreasing no-show rates in populations falling below the poverty line, among ethnic minorities, as well as Medicaid enrollees as well. And telederm really has the potential to mitigate significant geographic and insurance-related barriers. One study that demonstrated this was looking at Native American populations and rural communities. However, it's worth it to mention that in the same study, only 9% of tribal facilities reported having telederm services. So although it may be beneficial, telederm is still not available on a widespread scale. This is in comparison to the success that was seen with My VA Images, which was a store and forward platform that enabled veterans to share photographs with their dermatologists. And this really improved access to dermatologic care in veterans living in rural areas or those with mobility challenges. And further, telederm has also enhanced access to those with skin-neglected tropical diseases. So we know that those that are afflicted by this typically are in impoverished areas of the world and already have challenges when it comes to access to medical care. So telederm really is promising for expanding accessibility to these populations. And so although we've seen improved access with underserved populations, there still are a lot of challenges that exist around digital access. So as we know, there's a growing divide digitally that has led to unequal access to virtual care. And we've seen this across all groups, depending on tech savviness. And so some of the frequently cited challenges that were across studies included lack of access to image capturing technology, poor image quality, as well as slow internet connectivity, especially in lower income areas. However, some studies have suggested that depending on the needs of a certain population, one method of telederm may be more beneficial than another. For instance, in populations that do not have access to high internet speeds or image or video capturing technology, store and forward may actually be a better option for these populations compared to real time for expanding care. And then although there are some challenges with digital access, we've seen some really important reductions in wait times using telederm services. And this has really been demonstrated with telederm triage systems that have been shown to reduce unnecessary office visits and referrals, ultimately leading to reduced patient volume and reduced wait times overall. In one study, the average waiting time for new patients actually decreased from 84.6 days down to 6.7, which is really significant. And in another study in rural South Dakota, the implementation of telederm reduced waiting times from 12 weeks all the way down to 1 week, while still maintaining a high level of patient satisfaction. And then telederm has also shown to be promising for reducing wait times even within primary care settings, where primary care physicians are able to manage a larger bulk of skin conditions using telederm, which has ultimately led to significant reductions in waiting times as well. In addition, telederm has also shown to be advantageous for those who are not close to care or who are in remote settings. In one study, veterans who needed consults for pre-op surgery were saved an average of 163 minutes and 145 miles with the implementation of telederm. And then telederm has also been shown to be cost-effective, especially when factoring in indirect costs, such as the reduced need for transportation, increased clinic productivity. In one study, telederm was shown to save anywhere between $10 to $80 compared to in-person visits. And another study that implemented a telederm triage system into a hospital in San Francisco also showed significant savings of $140 per patient. And so one other population that I'd like to touch on are the geriatric populations and how telederm can be useful for improving access within this population. So although a high percentage of geriatric dermatology conditions can be effectively managed using telederm, there still are mixed studies when it comes to the actual use of telederm services within this population. For instance, in one study, they showed that adults 65 and older used telederm at a higher rate than younger populations. However, on a follow-up study, they showed that elderly populations actually use telederm services at a significantly lower rate compared to younger populations. So more studies are needed to understand how exactly telederm impacts this population. So now dropping down to diagnostic reliability. So across studies, there actually is a really good diagnostic agreement between teledermatology and in-person visits, with some studies citing diagnostic agreement at 68%, others cite even higher at 80 to 90%. And telederm was the best at diagnosing acne, xerotic eczema, pigmentary disorders, as well as superficial infections, scars, inflammatory lesions, benign tumors, as well as hair disorders. And although telederm has shown in some limited studies to have a high level of diagnostic reliability in inpatient settings as well, there still exists more discordance regarding follow-up treatment plans and how to manage patients long-term. With that said, though, there also have been studies to show high rates of agreement achieved in replicating diagnoses for pediatric skin conditions as well. So overall, good diagnostic reliability. Another area that has been really important in this is how telederm can help facilitate skin cancer screening or its diagnostic reliability when it comes to benign versus malignant lesions. So in one study, they found that with benign skin tumors, telederm actually had the highest rates of accuracy, cited up to 70 to 80%. We had a drop down, though, among malignant neoplasms at 56% for actinic keratoses and 65% for basal cell carcinoma. And the overall lowest diagnostic reliability was seen with seborrheic keratoses at 41%. So with that said, the studies are mixed when it comes to telederm's diagnostic reliability with malignant lesions. Other studies have shown that fewer than 7% of malignant skin lesions were missed using telederm assessments. So really, additional research is needed to further understand this area. And then a few other topics within this part of the presentation I wanted to touch on are first, acne. Acne holds a lot of promise for being managed through telederm, and it actually carries with it a very high level of patient satisfaction as well compared to in-person care. It's actually one of the most effectively managed conditions over telederm. And providers also rate their confidence level with being able to manage and diagnose acne over virtual visits to be very high. So a lot of promise there. And then hair. Hair has also been an important part for diagnostic reliability in teledermatology as well. One study found that telemedicine actually had a 100% accuracy rate in diagnosing the type of alopecia. In addition, another study showed that telederm can also be used to more correctly diagnose more complex hair disorders like loose anagen syndrome as well. And now continuing on to patient care quality and experience. So overall, across studies, patients had a high level of satisfaction with telederm services. Although it's worth it to mention that the majority of these studies investigated satisfaction of store and forward methods compared to real time. So additional research is needed to further understand satisfaction level with real time telederm. However, many studies showed favoring of virtual consultations over traditional face-to-face appointments. In one study, patient satisfaction was rated highly at 84%, with no significant difference shown between age, sex, ethnicity, or method of telederm used. And then even during the early stages of COVID-19, when we were transitioning to virtual care, patients still reported a high level of favor with using virtual care. Some pitfalls that I'd like to touch on, though, are when it comes to using telederm services, some patients may report feeling less informed about their diagnosis compared to in-person visits, and some did not feel as involved in the decision-making process. Other studies have mentioned a lower adherence to treatment with patients using virtual care compared to in-person visits as well. And those who have limited digital literacy may also have a lower willingness to partake in telederm services. And so now moving on to privacy. So the COVID-19 pandemic, during this time, it really caused a lot of relaxed standards. And although the objective was to expand access, it actually, on the flip side, resulted in providers using non-encrypted platforms like Skype and FaceTime. In addition, some of the regulations favored leniency in relation to HIPAA violations, where providers were acting in good faith. However, currently, platforms must meet the standard of being HIPAA compliant. This includes encrypted communication platforms, as well as using electronic billing to avoid fraud, as well as including security protocols and password-protected devices to prevent the sharing of patient information. With that said, though, there still are a lot of studies that point to a great concern with privacy. In one study, the willingness to partake in telederm services was impeded by fears of unintended recordings, leakage of digital information, as well as breach of data. In individuals with more sensitive derm conditions that requires the photography of more intimate parts of the body, they reported higher levels of concerns with privacy as well. And then also, there exists a lot of parental concerns for our pediatric patients in managing skin conditions virtually as well that need to be further investigated. And now moving on to insurance and policy. So, like I said before, there was a lot of policy shifts during the pandemic, but when it came to reimbursement, this actually worked in favor of increasing reimbursement for telederm services. This was especially in favor of real-time methods compared to store and forward. And this was mainly made possible through the COVID-19 public health emergency waivers. In addition, some states had the temporary removal of interstate licensure restrictions as well, which improved access for patients seeking care across state lines. However, with the ending of the pandemic, many of these licensure requirements have returned, making it difficult to practice across state lines, as well as where the reimbursement level of Medicaid and Medicare are uncertain for the future, as many of these waivers are set to expire, which could prove to be challenging and have individuals lose access to care across different populations. In addition, malpractice continues to be a concern. Although there are some few limited studies that show that no cases of medical malpractice have been reported using telederm, really more studies are needed to further understand this area. And now, finally coming on to technology limitations. So these were just some of the few technology limitations that were cited across studies. For example, poor image resolution or suboptimal photography, limiting diagnostic accuracy overall. In addition, high implementation and maintenance costs and the need for secure data transmission, as well as the need to train staff using this technology. Other barriers are slow internet connections, which cause delay in image transfer and can also lead to disruptions in workflow efficiency. Other issues seen were longer face-to-face consultations, the lack of standardized image protocols and platforms, which led to inconsistent visual data, and also just technology that can't integrate into existing clinics or hospital systems. So, it's important to recognize what these limitations are and to continue to investigate how to improve these areas if telederm is going to evolve for the better. So in conclusion, telederm has shown to be effective and cost efficient, while also helping to provide access for underserved populations and reducing unnecessary referrals. It maintains a high level of diagnostic accuracy. It reduces wait times as well as improving healthcare costs, while also having a high level of patient satisfaction. Although there remain barriers to widespread adoption, namely internet access, the lack of telemedicine integration in certain populations, as well as privacy concerns. Overall, though, telederm has the potential for improving dermatologic care, but overcoming these barriers really requires investments in digital infrastructure, as well as provider education and policy reforms to sustain its long-term viability. Thank you.